Now this is your lower extremity again. Now we're focusing on the hip muscles. In particular, we've got some hip flexors in the front. All right. This is your low back. This is your tailbone. This is your pelvic basin, bony pelvis. And check out this muscle right here. That's called your iliopsoas. So see how that attaches to your spine in the front. So all your guts would be right here. Attaches to your spine in the front. And then it attaches on your femur here, on the inside of your femur. So when you do a knee strike or basically in a seated position, this muscle is chronically shortened. It's called the iliopsoas. It is the filet mignon in a cow. And then you've got a muscle called the rectus femoris, which is also a hip flexor. Let's see what these muscles do. All right, that's hip flexion. Hip flexion. So we're sitting all day long in a bent knee position. Those muscles are short, and then when we finally go to get up, they stretch out and they yank our spine out of whack. I'm dealing with this a lot in the office, okay? Very common. So there's the hamstring groups again. And then here is the big prime mover of the hip. This is the gluteus maximus. And if we peel some layer, the next layer in, next layer deep is the gluteus medius, and then there's the gluteus minimus. Giant, middle-sized, and tiny butt cheek muscles. Notice how they come out here and they attach to the thigh at a place called the greater trochanter. So I'm always telling people, a lot of folks will come out here, if you feel on your lateral thigh right now, there's a very exposed area there, so it's very bony, whereas this is all muscle, right? You'd feel the butt cheek versus trace it out laterally to where it attaches. And that's called the greater trochanter. It's a big bump. And let's see if I can capture this. I color code it and show you what happens. So there, the muscle's activated as if we're running. We're climbing a set of stairs, and you see where it attaches right out laterally. The hamstring's assisting as well. So right where it attaches here, it gets very pissed off sometimes, okay? And that's a greater trochanter. Trochanteric bursitis is among the possibilities there. All right. And then look at, it's easy to see why the low back is so problematic, right? Because you got these big, powerful muscles that are attaching. And it's a real sturdy area in the low and lumbar spine as a result of all that force going through there. Flexion, extension, that this area right here gets beat up quite a bit. All right? That's called your lumbosacral junction. That's where your low back pain lives. Again, flexion, hip extension. A little clinical pearl, as mentioned earlier. So this is anterior and this is posterior. This is your butt cheek. This is your lumbar spine. This is your hamstring. This is your quad. We spend a lot of time in this position, sitting down. So the hip flexors are tight and short. Meanwhile, when we're sitting, these muscles that are activated in red, the glute, the hamstring, you're sitting down on top of them with a portion of your body weight, a significant portion of it. And so you're kind of turning them off. You're inhibiting their contraction. So if you sit so long, your butt cheek's going to get really, really sloppy and flabby. Hamstrings aren't going to work properly, and then you're going to have a low back problem. So you got to be long to be strong. Make sure that you are stretching out every day, modifying your workplace ergonomics, staying lean and taking care of yourself. Yes, yes?